A new poll shows Americans are overwhelmingly in favor of new restrictions on gun ownership. As the debate over gun control rages, 92% of Americans support background checks before an individual can purchase a firearm. According to the CBS News New York Times survey, just 7% are against the measure. At present, only 7 states require people to pass a background check if they want to buy a gun at a gun show. 10 states have some restrictions, but 33 states, more than half, do not require applicants to pass a background check if they buy a gun at a show. After last month's mass shooting at an American elementary school, one state decided to approve a gun control law, which is now the toughest in the nation. But one provision in New York's legislation is stirring controversy among mental health experts. Karina Huber explains.
Jared Lee Loeffner, Eric Harris, and Dylan Klebold, Sung-Hui Cho, James Egan Holmes. This list of shooters responsible for some of the deadliest attacks in recent U.S. history have a trait in common. They were all mentally troubled. Since last month's mass shooting at a Connecticut elementary school, the neighboring state of New York has enacted a new law requiring mental health professionals alert authorities when they believe someone could be dangerous. Law enforcement can then confiscate their weapons. Mental health experts are up in arms. Carol Bernstein, former president of the American Psychiatric Association, believes the law is well-intentioned, but doesn't think it will do much to stop the next Newtown.
I can just see mountains of paperwork where names are being submitted to one person who won't know what to do with them, and we still won't have protected anyone.
The new law wouldn't likely have stopped Newtown shooter Adam Lanza. Law enforcement says he was diagnosed with a mild form of autism, but had no reported history of mental illness or violence. Mary Lee Gupta, program director at mental health advocacy group NAMI New York City, says the law threatens to marginalize the mentally ill and could discourage them from seeking treatment.
People with mental illness are much more likely to be victims of violence than to be the perpetrators of violence. I think to associate firearms with people with mental illness, I do think that that's further stigmatizing people with mental illness. It has that potential for sure.
And mental illness is very common in the U.S. and internationally. According to the National Institute of Mental Health, 1 in 4 American adults suffer from a diagnosable mental disorder. 1 in 17 have a serious disorder, including schizophrenia or major depression. But only 1 in 3 diagnosed adults are in treatment. Mental health experts say a key component to stopping more shootings is to destigmatize mental illness and make treatment more available and affordable to those who need it before tragedy strikes. Karina Huber, CCTV, New York.